So how can you avoid back pain using a baby carrier? I think one of the most important things for us to recognize is, yes, carrying a baby on your front increases the stress on your low back. There's no question about it. However, if you go out and poll 100 Americans, 90 of them will tell you they have low back pain. So everybody has low back pain. So what I would recommend for our country at large is that everybody build their core muscle strength. So that's your abs, your back, your butt, and your pelvis muscles. We all need to be stronger in this area. And it won't just help support your low back, it supports your hips. It keeps you from being old people who fall over and break their hips. So that's a very important area. The best ways to do this, yoga, Pilates, doing planks, doing bridges, all of these things are wonderful for your core muscles. The other thing that we know definitely increases your risk for low back pain are tight hamstrings and tight hip flexors. And I will tell you the vast majority of adolescents that I examine have tight hamstrings and tight hip flexors. And so I'm assuming that most American adults do as well, because who has even less time to work out than teenagers do? It's adults with actual jobs and lives. So these are all things that we should concentrate on, not just people who are wearing baby carriers. But if you're using a baby carrier, doing all of these things can actually help decrease your risk for back pain, both using the baby carrier as well as in your general life. And then I'm always yelling at kids for their posture, which parents love. How can we avoid back pain if we're going to use a baby carrier? I think the baby carriers that have a lumbar support are very helpful. Also, making sure the straps fit snugly so that the child's not leaning out forward. That pulls your center of gravity forward even more. So having it nice and tightly against your shoulders will help a lot. And take breaks. Give somebody else a turn to carry the baby around. And don't carry your 40-pound baby in your baby carrier, because that will, I promise you, will make your back hurt. What other things do we look for in a baby carrier? We want a carrier that allows you to make this very important eye-to-eye contact that Dr. Kennel has emphasized. It should be comfortable for you and for your baby. Allow the baby to face out once they're ready to do so, and feel safe to you. And so some people will feel more comfortable with one carrier than another. Find one that works for you. And you certainly don't want one that causes the very young babies to have their heads forced forward onto their chest, because we do worry about the airway in that case. We want it to be easy to take on and off. And so obviously we don't all have help getting our babies in and out of their baby carriers, so it should be something that you can do on your own. So the mom or the dad should be comfortable getting on if there's not going to be anyone around to help them. And you should like it. It should feel comfortable for you. So try different ones and see what works for you.